Joining me from Denver is Dr. Harley A. Rotbart. He's the author of the book No Regrets Living and an emeritus professor of pediatrics at University of Colorado School of Medicine. Dr. Rotbart, is there actual evidence, scientific data that show kids are getting sicker with Delta variant more so than with the original strain we saw in the beginning of the pandemic? I mean, based on that report you probably just heard, it certainly seems that way.
Well, the evidence that you're asking about is not yet there. What we do know is that the number of cases in children is dramatically higher. The number of hospitalizations of children is dramatically higher. But what we don't know yet is if there is a virulence factor, that is a more dangerous factor for the Delta variant than for the previous strains of the coronavirus. It could all be, as someone in your report just said, a matter of numbers. That is, we know this virus, the Delta strain, is far more contagious. There are higher numbers of viruses in the noses and mouths of infected people. And that, in addition to the fact that the genetics of the Delta variant make it more contagious, many more children are becoming infected. That does not necessarily mean that the hospitalizations are due to a more serious strain. It may well be that the more infections you have, the more children are going to be hospitalized just on the basis of sheer numbers. It may turn out that Delta is more dangerous. It may turn out that Delta is more virulent, more powerful. We don't know that yet.
So, Dr. Rotbart, how do we best protect children under 12 when clearly they are not vaccinated yet?
The most important, and this is going to sound like a broken record because you've heard this so many times now in the past 6, 9, 12 months. The most important thing is to get the adults who are around the children vaccinated. As you heard, none of the, and this is true around the country, none of the hospitalized children have been vaccinated. Unfortunately, only kids older than 12 are even eligible for the vaccine. And so what we have to do is we have to surround the younger kids, surround them with vaccinated adults. That said, in communities where vaccine rates are low among adults, or lower than they should be, we still have to protect the kids with the basics. The kids need masks in school, the kids need social distancing in school, and the density of kids in classrooms and in cafeterias needs to be reduced. That proved to be effective during the previous wave of the pandemic. It will prove to be effective now too. The most important thing is to get the kids into school. We can't keep them home any longer, but when we get them into school, we have to protect them.
What would be your message? And I know the mask issue has become a lot political, but what would you say to politicians or parents who don't want their children to wear masks in their classrooms?
You know, it's an understandable concern because psychologists have told us that kids need to see facial expressions, they need socialization, they need to be able to express themselves with the half of their face that may be covered with a mask. But this is a very unusual situation. And the American Academy of Pediatrics, which is the best advocate for children in the world, has recommended masking for kids, recognizing that it's not perfect because there are risks. There are social risks, there are emotional risks, there are fear risks, because we do create some fear when we tell kids, you know, you have to put this mask on to protect yourself. There is a fear factor. But until we get this Delta variant under control, until we get a feeling for how fast it's going to spread in schools, we do need to take that precaution. I'm hopeful that what we'll learn as kids go back to school is that this is not a worse situation than we saw during the first wave of the pandemic. And the first wave of the pandemic taught us that schools are not the major sources of transmission. Schools are not the villains. And therefore, we might be able to relax a bit in our masking as we see the school year advance.